Autism is a neurodevelopmental disorder that affects one's cognitive, sensory, and social processing, changing the functioning in common situations. In 1943, autism was first diagnosed to describe children with intense social withdrawal, but scientists now describe it as a neurological disorder that impacts functions of the brain. Autism is characterized by repetitive patterns of behavior and interests and difficulties in communication with others in social interactions. However, autism characteristics are unique and vary child to child and can change over time with services and support. Research has found that children who are diagnosed with autism see early signs before the age of 3, such as being overly focused on an object, lack of eye contact, delayed speech and language skills, unusual physical behaviors such as twirling and flapping their arms, and having difficulty understanding nonverbal cues. Scientists have found that autism is due to both genetic and non genetic causes, but there is no known single factor as to how it's developed. Twin and family studies suggest that some people have a genetic predisposition to autism, that spontaneous gene mutations can also influence the risk of developing autism. Non genetic causes can be environmental factors, such as toxic exposures, prenatal infections, and perinatal insults, or medical conditions that are associated, like epilepsy or Fragile X syndrome. For certain, autism is caused by abnormalities in the brain structure or function. Based on the characteristics of children with autism, it is important as educators to identify and address the areas of deficit, especially social processing, communication skills, academic, and behavioral skills. Educators should also focus on the idiosyncratic interests and talents and implement them within their instruction to improve academic and behavioral outcomes. Along with social skills and high anxieties, many children with autism also struggle with abstract thinking, but have visual strengths. One of the most popular strategies used when teaching students with autism is visual supports. Visual aids promote proper functioning and positive behaviors. Some examples are objects, pictures, symbols, and daily schedules and stories. Visual cues are used to teach students with autism language and nonverbal cues of others. These can be graphic organizers or communication boards, pictures, symbols, labels, objects, and picture instructions. By using these visuals, children with autism can improve their social processing and communication skills. Daily schedules can be used to reduce anxiety by clarifying what subjects and tasks will be involved during the school day and if there are changes to the child's routine. Schedules can look like a first then board, which visually represents a particular task's steps, or a daily schedule of events and times so the child knows when to expect different activities. Social stories help students with autism better understand and cope with different social expectations and situations. These can assist in behaviors transitioning and helping students understand social cues and interactions. For example, making a story with pictures of a student's new teacher and desk can help alleviate anxiety transitioning to a new grade and promotes behavioral expectations. Pivotal response training is a naturalistic, multi-component behavioral intervention that helps improve communication, play, academic skills, and social interactions with peers and adults, to which focuses on the child gaining motivation, initiation, and responsivity to cues. PRT emphasizes the importance of improving functioning. According to Stammer et al. Of 2013, specific elements of the EBP include clear and appropriate prompts, child choice, turn taking, interpersonal and maintenance tasks, reinforcing attempts, responding to multiple cues, providing contingent consequences, and ensuring a direct relationship between the child's response and the reinforcer. In implementing PRT to develop language abilities and reduce unwanted behaviors, educators and researchers use games and natural activities. This specific EBP is intended to be implemented in the classroom and at home, which increases parent involvement in their child's academic and behavioral development. As PRT is based on game activities initiated by the child, parents can be active in their child's treatment plan at home. Parents receive PRT training within a time period that teaches them strategies for working with their child at home. This EBP allows teachers and parents to work together in a natural setting with the child to use their developing communication and social skills. Social skills training is known as any direct instruction targeting improvement in social skills. In order to do so, educators teach social skills in small groups by demonstrating and modeling how to effectively communicate in different situations and scenarios. In results, studies show decreasing aggression and positive interaction. SST can also benefit students with autism as it provides them with the skills needed for daily interaction and functioning, as well as to assist with their struggles of daily routines in the classroom, allowing them an opportunity to learn to cope with their anxieties and interactions with others. One way to implement SST is by incorporating technology programs and videos. By using technology, children with autism are engaged in watching instructional videos on social interactions and then are asked to model the interactions with an educator or a parent at home. With technology being used widely, this is a great way to use SST and engage the students. As SST programs are focusing on teaching students with autism to learn how to behave and interact in different social situations, the instruction can be based on social stories, role play, and video modeling in order to develop the students' ability to make friends, interact with others, and build positive relationships with peers and adults. Autism diagnoses have been increasing at high rates as of recent years, and because of this, it is important as educators to understand how this disability affects children's development and identify and address the unique deficits each child with autism has, along with their strengths and interests. By implementing EBPs such as visual supports, pivotal response training, and social skills training, teachers can effectively guide students with autism in developing and improving their social processing, communication skills, academic, and behavioral skills.